thank you, ILSI, for the opportunity to speak at this conference, which I guess is a very important one to think and talk, discuss, and also maybe practice tomorrow. Risk analysis and risk assessment as two important developments over the last years, decades in some cases, and to see where we are, to see how we can share knowledge from different perspectives. I'm a microbiologist by training, as you may have heard, so I'm a little bit more biased to the microbiological risk assessment part of things, but I appreciate chemical risk assessment a lot, also because it's already 50 years or more old, while microbiological risk assessment is only a young thing of 10, 15 years. So we do things differently in those different science areas, but I think the principles we work on are very importantly similar, not always the same. But I think also after all those years of development, we've seen that important organizations like Codex or Alimentarius and many countries around the world have adopted these frameworks like risk analysis and approaches like risk assessment as their standard to define what safe food is. So it's a very important maturation process that has happened certainly in the chemical risk assessment area that maybe microbiological risk assessment can piggyback right on. So in my presentation, I will cover resources for you, and I hope that I'm not pointing to resources that you already know by heart. I would apologize for that, but I thought I might go around the world like Bobby did for food pathogens and food safety issues, and look at what sources can you find around the world. In the discussion later, we can look at whether we have sources like these in India that I'm not aware of, because I'm not necessarily very up to speed with the situation here. We can also discuss how similar sources could be established in India. But importantly, these are sources that you can tap into yourself from India. This is knowledge that in many cases can be used with an informed way, I should say, also in the Indian context. So we'll look at some of the resources from the organization that I represent. We will look at international organizations that are mentioned on this slide. We look at Europe, and we will look at a specific resource in the US. So the ICMSF, the International Commission for Microbiological Specifications for Food, is a very small organization. It's a group of about 20 microbiologists from many different countries in the world. We have kind of a good range nowadays around the world. We are 50 years this year. We exist 50 years. So over the years, this kind of a small group of microbiologists has looked at a number of different areas relevant for food safety, and in recent years we've looked very much at risk assessment. We try to discuss within this small group, which is composed of representatives from governments, industries, and academia around the world. We like to discuss the ongoing issues, the future, how we can harness ourselves better for future. We fight a lot, and after that we drink a beer, and we not always get consensus as Codex would try to do, but at least we get a good feel for how we can bring things together, how as stakeholders in discussions we can see what kind of information helps all stakeholders, where should we go with that. And in this slide you may, if this works, now I think Mr. Goodman, you used up the battery there. But I was going to say Kiran Bilangar, who's in the audience, is also one of the ICMSF members, and together with me and Nimisha, he will be running the Microbiological Risk Assessment workshop tomorrow, to which we very much look forward to. So ICMSF is a very small group, but we have been working for 50 years. And we have a website on which you can look and find our fruits of labor. We have published several books, papers. We have software tools that you can use for different aspects of food safety management and risk assessment. And we also produce or are producing more and more layman guides, so trying to translate scientific technical terms and concepts into more understandable, not everyday language, but to easier accessible language. Some of the publications we have issued over the years are really to validate our own thinking, our own concepts, very much also inputting into the Codex thinking process and decision process as one of the observer organizations. We have in the past issued documents on new trends in microbiological risk assessment and food safety that have been taken up by Codex. And I'm just not going through all the publications, but just to point out for this one, for instance, that we've looked at microbiological criteria as a kind of a semi-risk-based approach to finding a way of setting a numerical standard based on testing for regulators, for industry to ascertain whether foods are acceptable for consumption. We've looked at epidemiological data, how they give you a feel for food safety in countries. We looked at specific situations, for instance, microcriteria for powdered infant formula. So we are a small group, bring together information on timely topics that we offer to Codex for consideration in standard setting. We produce a series of books. We are now looking at books that have as a theme that they give you all the information you need to establish good hygienic practices and HACCP in principle. And we are extending this to inputs and principles of risk assessment. So I'm not going to probably dwell on these, but with these papers and books, we also have produced software tools, simple Excel spreadsheets with good guidelines that help you, maybe as a regulator or as a food industry person, to establish what number of samples should you be taken to see whether a food product would comply to certain criteria of safety. We have produced software tools in the risk-based approach, how you could, let's say, calculate with inputs from your different steps in the manufacturing operation, whether you would comply to what is called a food safety objective, a new term in microbiological risk assessment developed by Codex, that is the end of the chain hazard level that would be tolerable. So we're trying to help in giving people the knowledge and the tools that allows them to improve on risk assessment. Well, in the bucket of international resources, a lot of organizations really have been active and on the microbiological side of things. These are some of the logos of the organizations involved, and we've heard a lot about Codex, WHO, FEO, individual governments in Canada, for instance, Australia, New Zealand, the US have been very much at the forefront of developments of the principles and the approaches, the technologies, the methods of risk assessments, and all the logos of the academia that have been developing this as well are not on this slide. We also see a number of organizations, international organizations on the bottom, ILSI, ICMSF, ICD, the Industry Council for Development, and these are organizations that in a way have offered platforms for discussion outside of Codex in the development of risk assessment that have brought stakeholders together for these discussions, or like ICD that have taken up the challenge of disseminating the information and training people around the world. So the Codex Alimentarius organization has been very, very important for the development of what we call the framework of risk analysis, which hasn't happened overnight. It was a development over 20 years. And at the moment, I guess we all know this kind of figure where the framework says that there are three distinct parts in risk analysis, risk assessment, risk management, and risk communication that, as Mr. Davis said this morning, have different and individual responsibilities, separated responsibilities. But they have in common, specifically for risk assessment and management, that they have a structure. They are systematic in terms of the process you go through, the thinking, the logic you go through each step. And risk assessment may then be the more scientific part of the risk analysis framework. Risk management is almost a more important one because that is driving whether risk assessment is used at all. That is the organization, the type of people responsible for the final decision. And risk assessment is really there to support the decision-making of risk managers. Risk communication, unfortunately, hasn't been developed and matured in practice a lot. I think only a few countries in the world have seriously undertaken structured risk communication studies. And I'm not sure whether there's any left that hasn't given up. I think the US is still trying to do very well on that. But risk communication is a challenge, and it's a dynamic environment like with every situation in risk analysis. I'm not going to go into details of this picture, but you've seen already today a lot the terminology risk assessment. It suffices to say that it's a structured process to bring together data from a lot of different information sources. Data on hazards, micro hazards, chemical hazards, data on the consumers affected, data on supply chains, value chains. So you have to bring a lot of information together, and the big value of risk assessment is that it gives you a structure to do that, to work through the complexity in an organized way. So in Codex and Codex working together with FEO, the framework has been adopted in all their activities, as also Mr. Davis said this morning. They also have separated responsibilities for risk managers and risk assessors. Codex Alimentarius Commission is the risk manager, and all its committees are also risk managers. And FEO are assisting the risk managers by providing risk assessment expertise through their consultative bodies. And I should show probably this slide. On this slide you see the organizations mentioned that give Zafar the risk assessment advice, give Codex the risk assessment advice. On the chemical side, these would be JMPR on the pesticide residue side, Zafar, apologies for the spelling mistake there, for food additives, and GEMRA for microorganisms. And next to that there are ad hoc consultations that are inputting into Codex committees. So these forums work according to, say, the latest thinking in risk assessment. And that latest thinking is not necessarily different in the process, different in the type of data required, but often it's different in the methodology, the type of data available. So Codex is a very important source because of the long development tradition of risk analysis and risk assessment. You probably do access Codex Alimentarius websites and get information from it. If not, please do, because it is a very rich, let's say, you can mine a lot of good information there. The meeting reports of the different committees, technical reports, risk assessments, monographs on chemicals, toxicological evaluations. And so there's a long list of things you can get from there. And also for GEMRA, for instance, next to risk assessment reports, which are, let's say, featured on the top line, GEMRA has been working through consultations to produce a lot of guidance on risk assessment steps. How do you do exposure assessment? How do you do hazard characterization? How do you do risk characterization? Also, a guidance on how do risk assessors collaborate, work best with risk managers. How about this interaction where roles need to be given separate responsibility, but the communication may not always be very aligned. So there's a lot of guidance, a lot of data on the Codex website. Next to that, it's important to understand that these risk assessments that Codex is asking FEO to make through GEMRA, for instance, are not there just for the science. They are there because they are the basis for standards designed by Codex nowadays. So the Codex Committee for Food Hygiene, for instance, has asked FEO for a good global risk assessment on salmonella in poultry, for instance, in eggs and chickens. So that risk assessment was developed over 3-4 years and then was providing input into the standard that we now are going to have on salmonella and campylobacter in chicken. So it's for a purpose. It's a cycling, it's an interaction between risk assessors and risk managers. And many more risk assessments have been done, micro-risk assessments have been done by GEMRA, and you see the full list here. They range from hazards in fresh vegetables, fresh produce, viruses in foods, and I must say these two are not very quantitative risk assessments. The others are, for instance, Vibrio in seafood, Salmonella, Campylobacter, Chronobacter sakazaki, is it now called, Enterobacter sakazaki here. Listeria was one of the first risk assessments. All these risk assessments have done for the purpose of establishing guidelines. And on the right side, you see the guidelines that these risk assessments had fed into. Again, if you are interested in microbiological risk assessment, this is an enormously interesting reading for you. These are good sources of information because they show you how big risk assessments can be made. Very data hungry, very long reports. Some of these are 300-400 pages. So there are a lot of good science there. Luckily, they also have executive summaries of 30 pages. That helps. But again, thinking about skill building, your interest in embracing risk assessment more, these would be very good learning materials, reading materials, to give you a view on how methodologies are used, how data are used to bring together risk assessments. Also, Codex and WHO, FAO try to get guidance for food professionals quickly, not always waiting on Codex to produce standards, but also to derive technical information nowadays. And here's an example where risk assessments on Chronobacter, for instance, led to the issuing of technical guidance to food professionals in hospitals and other settings that were responsible for formula preparation for young children to adhere to hygiene and other insights that the risk assessment brought. With risk assessment being a very important activity in Codex at the moment, but understanding that all those 300-400 pages risk assessment might not be very accessible to people, but also not allow them to look at their own situation necessarily. FAO and WHO have decided to start producing websites on which they post tools that you can use to do your own risk assessment. For instance, there are two tools at the moment. One is for Chronobacter in infant formula, and I have a few more slides on that. And the other tool is looking at the progress of Campylobacter, Salmonella through value chains of poultry. So the Chronobacter sakazaki model on powdered infant formula was developed over the last 5 years. It's in the process of being finally validated. The information is on the website, but there's a report made to acknowledge it's valid, to give more guidance next to the software, so to speak, on the website. It allows you to look at 3 different streams of activities, looking at the concentration in the powder, the base infant powder, the total number of Chronobacter at consumption, and then establish the dose per serving, which gives you the number of potential illnesses. So you can use your own data in this risk assessment. That's the value. So for your own country, for your own situation, you can look at that. Achilles heel, a drawback of this model is that environmental contamination is not taken into consideration. And we know that in practice, a lot of the risk of Chronobacter in powdered infant formula is at the stage of preparation, slow cooling, but also being, let's say, open to contamination from the outside. So there are many, many GEMRA resources also posted on the websites of FAO and WHO. And for all these slides, I have the references for the emails for the websites on the bottom of the slide. And I believe these slides are made available after the meeting. Just want to point out a few tools in the middle, which are predictive modeling tools that you can access through this website. And predictive modeling is used a lot as a simple approach to calculate growth opportunities for microorganisms in more and more complex situations. And they're one of the key inputs into micro risk assessments. And in the workshop tomorrow, we may have time to look a little bit longer at those tools. So in chemical risks in food, obviously JECFA, for instance, is a very important organization, as I mentioned before. They are the risk assessor group, the international risk assessor group, feeding in information to Codex. And there's a website where you can find all their information. On the other hand, WHO also runs the International Program on Chemical Safety, which I think would also be a very good source for risk assessors to tap into when they are from the chemical risk assessment area. And the IPCS objectives are to establish a good scientific basis for sound management of risks as per the principles of risk analysis. So they have a flow of activities going from assessing risks, building the evidence, publishing on that, advising on standards, not necessarily setting the standards, and at the end building capacity. So here in the IPCS website you see a lot of information. For instance, the top 10 contaminants around the world, there's specific information on them, and you will find information on dioxin, maybe lead, mercury, arsenic, very timely at the moment in the US, I believe. So there are a number of sources here, but if you troll their website, there's... Then also through the IPCS, they have established what they call a risk assessment tool, risk assessment. So there are a number of tools available that might help you either getting more experience, getting some education into what risk assessment is, but also to use as sources that you can tap into if you have gaps in the data in your own country, for instance. And here are the websites for general access. One of the organizations I work with is called the Industry Council for Development, and it's a small public-private partnership set up of a number of companies with FAO and WHO, with the ambition to do training, skill building around the world. There are training centers in Jakarta, Indonesia, and in Accra, in Ghana, from which ICD works. But ICD, from next year on, will be part of ILSI's Platform for International Partnering, PIP. But in the kind of 20 plus years of ICD's existence, it has developed a number of very helpful training courses. For instance, food safety for nutritionists and other health professionals, courses on HACCP, the principles and the practice, even food service information on good hygiene, good practices, and the most recent one is a manual on microbiological risk assessment. And in the workshop tomorrow we will use a number of the modules from that material in our training. So these courses were developed by ICD with FAO and WHO. WHO and FAO also have scrutinized the content of this material. This material is freely accessible. There's no copyright on it. We only ask you to not change the content. The PowerPoint slides are actually made available with notes. And there are also, like shows on this slide, we also offer this information with guidance for users, training other people. So it's a train the trainers idea behind it. We give some idea on how you could structure information dissemination using this course in 3, 4, or 5 days. So most importantly, there are 9 modules developed that take you across all stages of risk analysis towards putting microbiological risk assessment in practice. Every slide deck in a module has speaker notes, so they will help in the train the trainer setup. But again, if you can use this for self-education, to look at this yourself. If you have an organization that it needs training, maybe more experienced people can use these kind of tools to train others in the organization. Then looking at sources from, for instance, Europe, I have some information on the European Union. The European Commission follows the same setup as Codex in a way, having a risk management body and a risk assessment body. The risk management body is the European Commission, DG Sanco, the Director General for Consumer Protection, and the scientific advice is coming from the European Food Safety Agency, EFSA. If you look at the information on DG Sanco, where risk management happens is really at ministerial levels within the Assembly of Countries, but there is a committee that gives input into that gives risk management advice to the ministers to help guide them in their decision making. And this General Product Safety Directive Committee also has published a number of useful tools, in a way useful information sources. They have drafted extensive guidelines for risk assessment, and I hope you don't mind that I also point out the risk assessment for dummies guidelines. That's one I used very early on. I think these are it's good to go to a variety of different resources in this regard, because they all are written because of the same principles, but with a different background, a different region that people are responsible for. So you will get different information from different parts. Risk assessment, very importantly, is the domain of EFSA in Europe, the European Food Safety Agency, that now has been in existence, I think, approximately 10, 12 years. EFSA embraces risk assessment, but also is responsible for risk communication. So it has a dual responsibility. Also, DG Sanco communicates next to risk management. Sometimes they communicate different things, which is interesting. But on risk assessment, EFSA deploys about 12 panels of experts selected from around Europe on personal merits, asked to work with EFSA for 2-3 years in their expert panel. And for risk assessment, the relevant expert panels would be the CONTAM panel, which is the panel looking at contaminants in foods, or the biological hazards panel, the one looking at biological or microbiological risks. And on this slide, you can see that there are panels on pesticides, on GMO, very specific groups. There are panels on plant health, on nutrition aspect, animal health and welfare. So they all have a component of risk assessment, but today I will only talk about risk assessment of chemicals in foods and microbes in foods. So, for instance, you can easily search the website and then come up with references on risk assessments in biological hazards. There are over 100 of these, and they are next to the information you can, for instance, get from Codex through GEMRA. They're good reading for risk assessors. They're very informative. They go into sometimes more specific regional dimensions of risk assessment. You can appreciate that if you do a global assessment, it gets kind of diluted. Some of the aspects can get diluted. If you go deeper, you compress it to more regional or a country situation, you can get out more specific information relevant for a country or for a region. So a good number of risk assessments are posted on EFSA. On contaminants, there are also many types of advices, risk assessments on, for instance, mycotoxins, nitrite in vegetables, mineral oils. So also good sources for specific information, but also looking at how people have put together a risk assessment. There's a very long list of pesticides being risk assessed, about 600 plus risk assessments on pesticides. A rich source of information. And then on the biological hazards panel, they have also made publications that give you some guidance as risk assessors on how to develop risk ranking. Risk ranking is an approach that you see a lot, not only in microbiological risk assessment, but it's not trying to give a number in the end about what pathogen or situation is more risky than another, but just to not give a number, but to compare them. What is more risky than what pathogen is more risky, what situation is more risky than another, so that you can make a decision where to focus your resources, your energy, rather than to say, well, that number is not the right number. You can have a large discussion about numbers being right. You can have a large discussion about science, because different people will take out different elements of science in their discussion. But if you put it in a relative way, some of that discussion is overcome. From EFSA and DG Sanko going to another group in Europe, which is part of the global ILSI branch. ILSI has, as you heard, many different branches and organizations around the world, but ILSI Europe is one that I'm very familiar with, and ILSI Europe has also produced a lot of risk assessment related information brought together by the various stakeholders from academia and government industry. ILSI works through task forces, and a number of task forces relevant for the meeting I would like to go through. You can find all their publications available for free on their website, and there are different types of publications. The blue books are monographs. They are a more easy read on timely topics. There's a report series, the black and white books. They are current, timely information for experts, meeting reports, proceedings of meetings, deliberations of experts that may be published at some point, but is already published as a black and white. And many publications in peer-reviewed journals, which is still, let's say, the gold standard for publicizing information. So the risk analysis in food microbiology task force is one of the task forces that provides information on risk management, and also has been involved in the last 10-15 years in helping bring stakeholders together for discussions on risk assessment, on food safety objective, and other new metrics. There's a lot of reports that I could name that would be relevant, but maybe to just point out a few recent ones that are maybe giving an idea of where we are taking risk assessment in the world. Risk assessment is not only relevant for setting food standards and for deciding on safety of foods on the marketplace, but it's also an approach that industries can use to work with regulators to say what treatments, what processing will deliver a safe product. You can do a risk assessment to do that, to see that. And ILSI Europe has brought together experts that have written now reports on risk assessment approaches to setting thermal processes for food manufacture. Brought together a report on all the tools for microbiological risk assessment, which go really into detail of methods and methodology, are a very good source for further reading. And also, for instance, the impact of microbial distributions on food safety, because we all know that microorganisms in structured food certainly are not homogeneously distributed. So how do you risk assess these? How do you appreciate the risk of such a inhomogeneous food? And also in the published literature, now looking at omics and trying to think of the omics technology and how that can help do quantitative microbiological risk assessments, looking at those new concepts, like, for instance, the food safety objective. In the risk assessment of chemicals in food task force, a lot of focus has been on, let's say, the review of the risk assessment process, maybe setting up risk assessment processes where they hadn't been applied before. Also trying to ensure they would deliver quantitative outcomes where possible. Of course, quantitative descriptive risk assessments can be very useful, but if we can associate numbers or rankings, that might be helpful. So this task force had done a good number of pieces of work over the years, trying to improve methodologies and also looking to establish tools that are helpful, for instance, to assess the risk. So just a few publications from that group in the black and whites, a lot of knowledge brought together about 3M CPD esters, for instance, very, let's say, well-received publication from a project, FOSI, has been published already 10 years ago, but still it's a very good source of information on how to do risk assessments on dietary nutrients. Risk assessment of genotoxic carcinogens. Carcinogens, as you all know, are a very important group of chemicals in food that are difficult to assess the risk of. Again, this task force has undertaken different ways of doing that, looking at different approaches to risk assess also that category, that class of chemicals. And for instance, the margin of exposure approach already earlier mentioned today is one of those. And then the Novel Food and Nanotechnology Task Force. It's a task force that has been working for a long time on novel foods, so foods with a functional component of which you then assess the risk benefit maybe of the functionality, the benefits of the functionality and the risk of the novel component. This task force has now been extended to also look at nanotechnology. Nanotechnology, of course, is an area where we have a lot of discussion about how to risk assess or safety assess engineered nanomaterials. And over a short period of time, this task force has produced some information that is hopefully useful on nanomaterials and safety assessment. Also here, there's a publication from this task force of Paul Hepburn, who was leading this, on the application of post-market monitoring to novel foods. And you can find more information on ILSI Europe publications from this website. So the last source I would like to point you to is foodrisk.org, which is an organization in the United States. It's a collaboration of the University of Maryland and the GIFSAN organization related to the US FDA. This is a website that tries to, this is an organization that tries to maintain a website bringing together risk assessment from all around the world. You will see the risk assessments from WHO there, from Europe, from EFSA, but you will also see risk assessments from countries where you might not have spotted them yourself, you found them yourself. And it's risk assessment mainly on microbiology. That's where the organization started to develop, but more and more they extended to chemical risk assessment too. And I can't go, because of lack of time, into the details of this, but I just want to flip through a number of the website's parts, of the pages on the parts. So there's a long list of tools here as well. Tools to assess dose response, exposure assessment, tools that lead you to predictive modeling, risk ranking, documentation. So for those risk assessors that also engage with the modeling, not only the data generation or the data assembly, this is a very good tool to point you through those software tools. Then risk assessment models, how they are described next to the tools, next to the software, in many different papers that this website brings together. As I said, it is from EFSA, but it's also from the let's say the different countries. Spain is mentioned here, the UK, Institute of Food Research. So you can easily find here things. Of course, you can also Google, but this is a website where, let's say, authoritative risk assessments are brought together for you. You can also look at specific micro-risk assessments combining pathogens to commodities. And here there's a list of, there's a selection of risk assessments on bacteria, viruses, parasites, prions, mycotoxins, and also in the area of antibiotic resistance. And on the website also databases are maintained, databases on agricultural commodities, food safety hazards, both biological and chemical. And some of these databases are very useful because they give you input into your exposure assessment. They give you, let's say, consumption patterns. They can give you all kinds of other information that are important for exposure. And there are learning resources as well, presentations, training resources that they have brought together from different parts of the world that people can access through the website. And finally, some more software. simulation and modeling software I found useful on this website. So also on the website are, for instance, about risk assessment, the various phases of risk assessment and risk management are also covered here. And you can find, again, brief introductions to the various activities, but also they will point you to WHO FAO's information from GEMRA. So in summary, I would say that, yes, around the world, many governments are adopting risk analysis as their day-to-day practice in, let's say, at the policy level, certainly. Codex, WHO, FAO have driven this for many years, have given a lot of guidance, a lot of consultation on the whole process. And while the microbiological risk assessment development is much less mature, also, let's say, has had much less time to mature than the toxicology risk assessment, I guess both are at a very mature stage already. And there are many resources available for people that want to move into this space of science and try to be helpful in educating people, not only about, let's say, what is the method, how do you use the method, but really also about what are the principles, how is this tool to be used. And I guess what I would say is that there are many resources available, but the true skills as risk assessors you would only develop through doing it yourself in practice and getting experience, so doing it over months and years. And hopefully when you get that information, that level of expertise and experience, you will also share it with others, because that's another thing that we need to really do, share information across risk assessors. And maybe, as it's suggested here on the last line, come up with a kind of a community of practice of risk assessors around the world that can make use of those databases and information that we already assembled, but help each other to gain experience, to do the right kind of risk assessment, and to help each other as well with covering for data gaps. Because many countries you will see data gaps either because there are no surveillance systems or data are just not being delivered to maybe reception points. So there's a lot of things we can do together around the world. And risk assessment, risk analysis, they give us certainly a new, more harmonized language to work together. And they come with a lot of relevance because it's all about public health protection and food and fair trade, but more in a homogeneous approach. So I would like to leave it at there, and I'm not sure whether I have time to answer any questions, but we have a discussion now, I believe. So thank you very much.